Today we're going to conduct a fitness testing session with you. This fitness test is going to help us understand about your current fitness level, and it will help us design a customized training program for you based on your fitness level. Within this fitness test, we will cover a number of different components, including your blood pressure and waist circumference. We will take your body composition test, which is a fat test, and we will do a upper body muscular endurance test through press-ups. We will do a cardiovascular test using treadmill, and lastly we will observe your posture alignment, including your head, shoulder, hip joint, knee joint, and your ankle joint, including your feet, to see if there's any abnormalities. I'm going to explain each of these tests before we start so that you know which test and why we're doing it. So the first test is the blood pressure. Blood pressure is basically the amount of pressure your blood exerts on your vessels, and it is important to note because it helps us understand if it's in the normal ranges or not. The second test is your waist circumference, which is important because it tells us about your overall health risks, if they are high or not. The third one is your body fat test. This test tells us that how much body fat do you have in your body as compared to the lean mass. The next test is endurance test, muscular endurance test. This will be based on a press-up movement, which is push-up. I'll ask you to do a maximum number of push-ups and see how many push-ups you can do before you get fatigued. The next test will be the cardiovascular test. This test is going to tell us that how good is your cardiovascular function, cardiovascular system is functioning. And lastly, we will observe the body's alignment to see if there are any abnormalities or we have to work on any muscular imbalances or not in the program. Before we get started, I would like to make sure that we have all the equipment we need. We've got a blood pressure machine, we have the measurement tape, we do have a BIA analysis machine, we have a mat, we've got a treadmill, and yeah, I've got a form and the pen. So let's get started. The first test is the blood pressure test. What I want you to do is sit relaxed. I'm going to put the blood pressure cuff on your upper arm, and then rest. The machine is going to measure how much is your blood pressure. So keep your arm relaxed. This will take a minute. What this machine does is that it's going to inflate this cuff. It's going to put the air in, it's going to inflate, and then the sensor in it is going to sense how much of the pressure your vessels are receiving from your blood. Oh, good. So the readings we got is that two different readings. One is the upper one and the other one is the lower one. The upper one is the systolic blood pressure and the lower one is the diastolic blood pressure. So if you've got 135/85, we will discuss these readings once I compile all the results. We'll discuss them in details. So for the next, I'll take this cuff off. I'll put it away. For the next test, what I want you to do is stand up straight, keep your body and your belly relaxed. I want you to put one of your finger into your belly button so that I know where your belly button is, because I have to take the measurements slightly above your belly button. All right, just let go. Let it go. Let it go. Let it go. Leave it. All right. 38. All right, for the next test, I want you to take your shoes and socks off. The next test is BIA. What this machine does is that it's gonna pass on a very light electrical current into your body, and then the current is gonna go through your body into the muscles and the other tissues which have more water, because they are more they are good transmitters of electricity. On the basis of that, it's going to calculate how much fat do you have in your body. So I'm going to need a few readings. Let's set this up. So your date of birth is 1989. All right, what I want you to do is step on it, hold the electrodes. %. Oh, good. Thank you. We're done with that. Just put your shoes back on. So now for the next test, it's muscular endurance. What I want you to do is first observe how to do the movement, and then I'll ask you to do it. For the push-ups, what I want you to do is put your hands on the floor as wide as your shoulders, right underneath your shoulders. And then I want you to keep your shoulder joint, hip joint, knee joint, and ankle joint in one alignment, in one line, so that your body is aligned in a straight line, right? And then you have to go all the way down. I'm going to put my fist under your chest. So what you have to do is go down, touch the fist, come back up, right? So I'll count each of the repetitions. How many repetitions are you going to do? So hands as wide as your chest, right under your shoulders, body straight, go all the way down, come back up, right? Okay. I want you to do 1 or 2 repetitions so that I can see how you're doing it. One more. Yep, pretty good. So let's get started. I'm going to put my fist here and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, as many reps as you can do. 14, 15, 16, 17, 18, 19, 20. Not bad. You're doing pretty good. Have a seat. How do you feel?
Good.
Is there any pain or discomfort in your upper body? Okay, good. Okay, so the next test is the cardiovascular test. We will use the treadmill. I'll ask you to walk for the first 2 minutes just to get the body warmed up, and then we'll start the test. For this test, you will walk at the speed of 5.3 kilometers per hour consistently. After every minute, I'll change the incline and I'll increase it. Yeah? Okay, let's get started. So this is 3 km per hour. I want you to walk for a minute on this speed. Then we'll increase the speed for the next 30 seconds so that your body gets warmed up, and then we'll start the official test. All right. Now we will increase the speed. So this is the constant speed you're going to walk on. And after every 1 minute, I'll increase the incline. The test is going to continue until you want the test to stop. Whenever you feel like you cannot continue anymore, let's stop the test. You can simply press the stop button whenever you want to stop the test, or you can pull the cable. So after first minute, we have increased the incline 2%. Now from here on, every minute I'm going to increase the incline 1%. Are you all right?
Yeah.
How long do you think you can continue with this test? Can you continue with this test for, let's say, another 2 minutes, 3 minutes,
So 1 minute.
1 minute? You can stop the test whenever you feel like you want to stop it. So 5 minutes and 20 seconds. How do you feel?
Tough.
Tough?
Yeah.
Okay. Is there any discomfort? No? Okay, let's grab a seat. All right, for the last one, I'll have to observe your posture. For that, I'm going to give you 30 seconds to just catch up your breath, and then we'll go for the next one. For the next test, I'm going to see the alignment of your head, your shoulders, your pelvis, lumbar spine, your knees, your feet, and your ankles. So I'm going to look at your body from two different angles. One is from the side and one is from the front. You okay to continue? Okay. Let's move the chair aside to make it easy. Okay. What I want you to stand straight, not with the wall. Come up one more step. Okay. Just stand normally. Keep your feet as wide as your shoulders. Relaxed. Yeah, we're all good. How do you feel? So you've done pretty good today. Awesome. What I'm going to do is I'm going to compile these results up, and then we'll discuss these results. On the basis of these results, we'll prepare your training program, and this is going to help you achieve your goals. I would also like to tell you that these results and the information we've collected from you, it is confidential, and then we're going to use it according to our legal and organizational requirements. So we will store this information safely, and after a certain amount of time, we will destroy that information, so this information does not get to anyone else. Apart from that, if I see anything in your test which is outside of my expertise, then I will refer you to another healthcare provider, either an allied health provider or maybe a medical professional, in case it's required. Thank you for your time today. If you have any questions, do let me know. And looking forward to working with you. Thank you so much.